The synopsis of the movie. Sean Murphy is a young surgeon who has Seven syndrome and autism. He moves from a quiet country life to join a prestigious hospital surgical unit. While being alone in the world, he uses his extraordinary medical gifts to save lives and overcome his co-workers' mistrust and unable to personally interact with others around him.
Autism, a mental condition characterized by difficulty in communicating and using language and abstract concepts. That's the definition. Does it sound like I'm describing a surgeon?
He's not Rain Man. He's high functioning. He's capable of living on his own, capable of managing his own affairs.
High functioning. Is that our new hiring standard?
If it were, you wouldn't be here. I'm sorry. Is this really necessary? Really? A special meeting of the board of directors, as much as I love you all, questioning one of my hiring decisions? Did you bother to look up the definition of president while you were skimming the dictionary?
You're hiring him to be a surgical resident, my department over my objections.
Marcus, stop making everything so personal.
I made it personal.
You've wanted his job since day one. Everyone in this room knows that. And Aaron, yes, this is your hospital, but the money it takes to run it comes from the foundation I control. So let's all play nice, shall we? Stop acting like you're stunned that you're standing there. You tried to slip one past us.
I vetted him like I would any other candidate.
And you generally thought that this board wouldn't reasonably have any doubts about hiring a surgeon who's been diagnosed with autism. So justify your decision.
I met Sean Murphy when he was 14 years old. I was living in Wyoming at the time. He was, and he still is.
In the first clip, the president of the hospital, Dr. Aaron Glassman, and the board are discussing on recruiting Dr. Sean Murphy. The majority of the board and doctors disagree and do not believe in him, as Dr. Sean is a young man with autism. But Dr. Allegra Aoki gave Dr. Glassman a chance to clarify his decision to hire Sean. We can obtain two critical incidents in the previous video, which is the first one is ableism. So what is ableism? Ableism is a discrimination of and social prejudice against people with disabilities based on the belief that typical abilities are superior. And its heart, ableism is rooted in the assumption that disabled people require fixing and defines people by their disability. Like racism and sexism, ableism classifies entire groups of people as less than and includes harmful stereotypes, misconception, and generalization of people with disability. One of the examples from this episode is autism. As I mentioned before, the majority of the board refused to hire Dr. Sean Murphy as a surgical resident in the hospital. This is because disabilities are a deviation from the accepted norm. Throughout the history, disabled people have been stigmatized. Disabled has been linked to disease and helplessness. And even in some cultures, disability is associated with ancestral curses. When Dr. Marcus Andrews said autism, a mental condition characterized by difficulty in communicating and using language and abstract concept, that's the definition. Does that sound like I'm describing a surgeon? This shows that he disputes Sean's ability in communicating and assumes that Sean can't do the job just because he can't communicate and has autism, even though Dr. Glassman do explain that Dr. Sean is high functioning, capable of living on his own and managing his own affairs. Not accepting and being open with Sean after hiring him might lead to perpetuate a negative view of disability, and he is not treated equally once he begins working in the position. He may be considered invisible. While his disabilities are still present and have an impact on the way that he lives his life. This shows that the needs of people with disability that are not clearly and physically visible are often discarded in the workplace. The greatest misconception about disability as a whole is that all people with any form of disability have the same capabilities and level of functioning. However, this could not be further from the truth. People with disability should not be stigmatized based on the sole fact that they have a disability. There are an infinite number of disabilities that a person could possess, and spectrum exists within most disabilities. Therefore, try to give them a chance, as each individual with a disability completely different and has capabilities and skills that are unique to them and not their disability. The second critical incident from the same clip is giving the chance to clarify. The purpose of clarify is to make something clear or easier to understand by giving more details or a simple explanation. Like what Dr. Elc650 did, she used the correct way in discussing by giving Dr. Glassman a chance to clarify his decision to hire Sean after seeing Dr. Glassman trying so hard to convince and persuade the board to support his decision, and Dr. Endo also starts to argue with him for hiring someone with disability under his department. By giving Dr. Glassman a chance to clarify his decision, they get to obtain more details to consider hiring someone with disability. They also tend to understand Dr. Glassman's decision better, and if the chance is not given, they might not hire Dr. Sean at all. It is so important to give clarification in every opinion or suggestion or decision that we make. This may be the support to our statement and helps other people to understand it. In any meetings or a group discussion, ask for someone's explanation can prevent from making any bad decision.
Hey,
Sorry, you seen Claire?
would you turn off the light?
Sure. You seen Claire?
Why? Would you turn off the light?
Melendez wants to operate on 104, but Claire hasn't gotten informed consent, and she's ignoring her page. You seen her?
No, now go away and turn off the light.
Sure.
I need you to,
I heard.
Oh, she's such a bitch.
This clip shows that Dr. Claire neglects her duty as a doctor by having an affair with Dr. Jared during working hours. This can be seen when her colleagues need to find Dr. Claire because she did not get the form consent to operate for her patient yet. Dr. Jared then covered up for Dr. Brown's action. We can also obtain two critical incidents here, and I will be explaining the first critical incident while my partner, Miss Mashita, will be explaining the second critical incident. So for the first one is lie to cover up. A cover-up is an attempt, whether successful or not, to conceal evidence of wrongdoing, error, incompetence, or other embarrassing information. Why is actually people willing to lie to cover up? Well, in this clip, Dr. Jared lied about Dr. Brown to attempt to conceal and also to protect himself because Dr. Brown is with him. If Dr. Brown is busted, then so he is. But if this continues to happen, Dr. Brown tends to reiterate the mistakes as she knows that there will always be people covering up for her. And if one day the lie is revealed, it will be really bad for their reputation, both the one that commit and the one that lied to cover up, as he will be accused of complicity. They should always remain professionalism in the workplace whenever they are in the hospital. Identify their personal boundaries and separate it from work. Not only does it make them look unprofessional and untrustworthy, but it can also damage their relationship with their colleagues.
As I have been mentioned by my partner previously, I will continue for the fourth critical incident with the same scene. The fourth critical incident is no professionalism in the workplace. As we can see, Dr. Claire Brown neglects her duties and causes her colleagues to fire her because she haven't received approval on the consent form to operate from her patient. The reason to this is because Dr. Claire Brown favors her personal interests more than her work. She does not focus on working and take her job as doctor for granted. This can cause trouble to other colleagues as they have to find or cover for her, as we have seen previously. Next, This can also tarnish the hospital's reputation, as they are workers who are not diligent in carrying out their duties as doctors. The organization should divide the staff room by gender to prohibit this kind of behavior and train employees to become more professional. The superiors should also monitor their subordinates more strictly so they will slack off during work.
Can Dr. Murphy do that? He can't even reliably show up for a job interview. Are you going to sit here and tell us that there were no other equally qualified young surgeons? Surgeons without this one's issues?
No. Which is why, exactly why, we should hire Sean. We should hire him because he is qualified and because he is different. How long ago was it that we wouldn't hire black doctors in this hospital? How long ago was it that we wouldn't hire female doctors at this hospital?
So you're comparing being African American or a woman with being autistic? Please, go on.
Okay.
The fifth critical incident is discrimination against black people and women. The scene is about Dr. Aaron Glassman is having a meeting with the board of directors to discuss whether Sean Murphy is qualified or not to be a surgeon. Dr. Aaron mentioned that the hospital has not accepted black doctors and female doctors for a long time. The cause of the incident is they think that women are not capable and qualified to work as doctors, as they assume that women are not as capable as men. Not only that, they also feel more superior than black people because of their different skin colors. This could affect people's opportunity to apply for a job, because there might be a bias and unjust recruitment from the employers in choosing employees, as we have seen previously. Not only that, this discrimination will also strain the relationship even further, as there will be boundaries between the workers and it will be difficult to work in a group. To solve this, people need to respect cultural and racial differences. We are communities with various color skin, culture, and religious beliefs. So we need to respect them without judging and discriminating them. If we show some respect and compassion to them, then they will return the favor. Furthermore, we need to be professional when working. We must not mix our personal beliefs with work-related matters. When choosing employees, we must choose based on their work experience and not their physical appearance.
I made him a deal. He's got a meeting with Dr. Max from psychiatry at 6. We'll get the consent by 8. We can operate first thing in the morning.
You did past anatomy, right, Dr. Brown? His problem's in his heart, not his head.
He's not psychologically ready for surgery. He will be, soon.
Oh, he is physically ready. So get the consent. We're prepping OR6 now.
Do I need to cite you the 17 studies that show a correlation between attitude and outcome in surgical patients?
Do I need to remind you that I am your superior? You do know what the opposite of superior is, right?
Subordinate?
Sure. Subordinate or inferior, either way.
It doesn't mean I'm wrong.
I suppose not, but it does mean you have to act like you're wrong.
The last critical incident is superiority in the workplace. The scene is about Dr. Claire Brown decided on what to do for the patient in room 104 without consulting with her supervisor, Dr. Melendez, beforehand. Then Dr. Melendez reminded Dr. Claire Brown that he is her supervisor. The cause of this is because Dr. Melendez feels that he is better than others and the need to be in control. That is why he mentioned Do I need to remind you that I am your supervisor? When Dr. Claybrown decided on things for the patient without consult with him first. This will be troubling for other workers because it would be difficult for them to communicate as he feels like he is more superior than others, so he won't listen to others' advice. And this can cause fights between colleagues because of the difference of opinions. This can be solved by trying to cooperate with others during work. Doctors are required to work in teams. Their job relies heavily on the flow of the work as most of the time. People's life will be on the line and their job is usually a race against time. Lastly, be an open-minded person. If we were given an advice, we should accept it and think of it as a chance to improve ourselves in the future.
In our opinion, after watching this episode and after we complete this assessment, we found out that we will somehow meet with many kind of personality and behavior in our workplace. It is important to us to always separate our personal matter with work to remain professionalism and always be nice to our colleagues in the workplace. And lastly, what we can do is try to find the best solution, especially using the theories that we had learned in this course to solve or to cope with any kind of situation that we will face in the future. I think that's all from us. Thank you so much. Bye.